What if everything you thought of health and wellness suddenly changed due to a hidden breathing problem that you were unaware of that affects every system in your body? Improper breathing habits are often overlooked in medicine. I'm Dr. Jenny from the Hobson Institute, and this is the Breathing Lab. Hello, everyone. Welcome to the Breathing Lab here. I have one of my very special guests today, Dr. Lois Laynee. Thank you so much for joining us, Lois.
Thank you for having me.
Do you mind if I call you Lois and not
That's
Dr.
my
Laynee?
preferred name.
Okay. So Lois and I kind of go way back. It's been a while since we've been together, but Lois has been a pioneer in the world of breathing and airway, and I've been able to take some courses from Lois and been able to learn a lot of different stuff. So I'm going to give you a little bit about her background. Lois Laynee is a dynamic pioneer and passionate lecturer in the field of education, sleep, scar release, healing, craniofacial, neurodevelopment, and much more. In addition to heading the Laynee Restorative Breathing Method, Lois is a speaker and educator of oxygen wellness and the creator of the Laynee Restorative Breathing Method. By combining her decades of clinical experience with the Laynee Restorative Breathing Method, she offers support for clients at all stages of life. And I also want to mention, she has a bunch of certifications. So she is an oral myofunctional therapist, oral myologist. She is a registered dental hygienist. She's a breathing coach. She's a dynamic craniosacral therapist, certified postural exercise professional, a functional movement systems, selective functional movement assessment certification, rhythmic movement therapist, craniofacial release therapist, and a certified lactation specialist. Also, she's an author, and she's written this book recently, Winning at the Game of Health. So that was a very good read. I think everybody should take a moment to do that. This I'm going to show a little bit later. So Lois, thank you so much for joining us today. And I know you're busy and have a lot going on, but I think what you have to say is very important for us, all of us to know. So thank you.
You're welcome.
So, you know, one of the things I have to say is that neurology is complicated. Okay. I'm one that I'm intrigued. I want to keep learning about neurology, but it's a little bit confusing. And I'll be honest, I'm a very mechanical person. And I've learned from a lot of orthopedic manual therapists. So everything fits in a certain way. And if it's aligned right, it works well. Neurology is not quite the same, right, Lois? Can you share a little bit about the cranial nervous system? That's really your forte. I think that's really what I wanted to bring to this group. This group is a group of professionals that is trying to learn from experts like you around different head and neck health areas that they might not know more about, but we need to know what's out there and know who needs it and who does it and who we can refer to if we don't know how to do it. So can you tell us a little bit about your background around the cranial nervous system and how you've created this amazing Laynee restorative breathing method?
Well, it all starts, believe it or not, when we talk about the nervous system and neurology, it's not the same thing. So your cranial nerves are not the same as your peripheral nerves, or your spinal column isn't the same as your brainstem, and your brainstem isn't the same as your brain, and your right brain is not the same as your left brain. So we segment things to learn it. And of course, no system ever works independently. So it's always going. When you look at the musculoskeletal system, I always say, well, where did it get its electricity from? Well, there's this nervous system, right? And then as you learn the different systems, what has happened over time is the cranial nerve system has been dropped as technology has emerged. So it's about time. There's only time to do everything. But when we talk about airway, that's where I'm like, that's wonderful, because cranial nerves run your airway. And it's not just your airway, it's your food way. And it's not your food way, it's your blood flow. So if we don't measure those, if we don't test them, you can have continued problems that in a person's mind are so separate from a cranial nerve. But the cranial nerve is your fuse box, if you think of that way. If you have a party with a bunch of women that have a long hair and you have 16 hair dryers going on, chances are you're going to blow some fuses. So people don't realize what blows a fuse of a nervous system, of your cranial nerve system. Well, they're injuries, and they're specific injuries. There's injuries that velocity of impact can alter a nerve. So what's the velocity of impact? Could be a baby rolling off a table, changing table. Could be a baby rolling off the bed. It's not about the car accident, because everyone thinks, oh, I'm fine. Really? No, it's I can't feel where I've been injured. That's our definition of fine. So if our fine is how we feel, but we can't feel that our oxygen sensor just got injured. No, we have to measure. Otherwise, we don't know.
So how do we measure the cranial nervous system?
Well, it's called a cranial nerve exam. Now, believe it or not, most people was never instructed and they never learned how to do a complete exam. So I have gone through and gone fiber by fiber. So here's the thing. In a nerve, my favorite little diagram, we have all these lovely little fibers. So if we focus on our muscle fibers, they're darn important. But if we have our sensory fibers and our autonomic fibers, that's what gives electricity to our muscle fibers. So if I have a vibration fiber, I have to test the vibration. If I have a temperature fiber, I have to measure the temperature. If I have a sensory fiber for stroke, I have to stroke. And if I have a sensory fiber for pressure, I have to provide pressure. So all of those have to be measured on each branch, and I would have a right branch and a left branch. And then I have to ask them if they can work together. Now, cranial nerves go directly to your brain. And in that system, the question is, are they accurate? Because if my face isn't accurate in my brain of my cranial nerve system, then my face isn't going to grow to the same potential. If I don't have enough electricity to my lips, I can't have lip together posture. If I don't have enough electricity to my eyes can't track. All of those make sense. And then for cranial nerve number 8, I have to be able to hear and interpret. That's, of course, more parts of my brain lobes. What is the sound through air? I have to identify it and I have to interpret it. Then I also, when I hear myself talk, I have to be able to, with a different part of the nerve, I have to hear the sensation through bone. And we understand bone conduction. But what we don't know, that in old-fashioned literature, traditional classical neurology is fiber by fiber, and we do it in a sequence where we don't override the brain. So it's like the most level 1 fibers are done first. We have to do it in a graduated sequence. So most professionals have had the information about cranial nerves, who they are, where they're located, what is the most common. Cranial nerve 7 is the most common birth injury. What other happens when you have, a stroke? There's these other cranial nerves that are injured depending upon where the location of a stroke is. But we don't understand the implication if one doesn't work, okay? Because think of them as they're on a relay switch. Well, if one doesn't work, how can it dampen down the others? But the most importantly is it dampens down your brain. So now the brain communication to the body is going to be understimulated or underfunctional. So yes, if you're a gait specialist, you're going to look at gait. If you're a jaw specialist, you're going to look at the jaw. But you could grind your teeth because you may have less blood flow to your occipital lobe, your cerebellum, and your frontal lobe. Not to mention your parietal lobe because you got hit in the head by a baseball when you were 7. So we go after it to where what your symptom is now. But in neurology, your symptoms are interesting, but they're not going to change my assessment. I'm going to check. And in most functional neurology, they start still, God love them, with everything on spinal, but your brainstem is your first. Your cranial nerves are the first to form. So you're only as strong as your weakest cranial nerve because the efficiency, all electricity goes from my brain to my body. It goes where? Through my brainstem. So it's the highway, and it's the place where we can be misdirected, misinterpreted. If we don't have enough blood flow, we don't have enough electricity stimulation, I don't get what I could be getting from my brain. So again, if I have all these hair dryers and I have all these things, I better have a bigger fuse box to run the system. And then it has to be accurate, which is accurate representation. If I touch my face here, do I feel it here? So there's a lot of mapping. We call it mapping.
Now, with patients that we see every day, I know I see a lot of children and adults, and my children are normally mouth breathing children that have poor sleep and their issues with concentration and school attention and all that. How would that present itself in the cranial nervous system? What would we find? What cranial nerves would be affected by a
I
chronically
love this
mouth breathing
question.
child?
Who knows? Okay. Because they may not feel vibration fibers. They may not have a lot of bone conduction through cranial nerve number 8. So they really don't hear. And if I don't hear and interpret sound, everything kind of sounds like this. I don't know what you said. So now it's going to be looking like I don't pay attention to you. Or what if I was bored around the cord, around the neck, and I couldn't move my head, cranial nerve 11. I can't rotate my head while I keep my eyes straight. So if my eyes go with my head, chances are I'm going to have a car accident because I can't look straight and move my head to see what? Glance and go. Is someone over somewhere else? Okay, so the implications is if I can't rotate my head and see, now we're going to add some more fun to this. How about and breathe and hear? I also could mouth breathe because I don't have an anti-gravity system in play. So that's part of my vertebral system, but specifically my gravity receptors. So to close my jaw, we know is cranial nerve number 5, but it's not my lips. Do my lips feel? Do my lips touch? Can they pressurize? Because I have pressurized systems. Well, that's a different cranial nerve. Is it anti-gravity? So that's the complexity of everything. It could be a gravity problem, not a jaw problem. So when you find this, you know, oh, I have opportunities to get a bigger electrical function from cranial nerve 11, and I can help cranial nerve 7, and cranial nerve 5 is a piece of cake now because all these other components are there to keep the process going. As you know, and probably most of your clients, they're frustrated because a lot of them are working really hard. And then comes the labels and just blah, blah, blah. What if instead of the word won't, we eliminate that? Because I only know what I won't do. In neurology, they can't. If they
I understand.
don't have electricity, they can't participate. If cranial nerve 9 can't regulate CO2, you are going to have a grossly under-functioning brain. Okay.
Well,
So if they don't work, the consequences can be really huge, but then we get labeled and we're going down a path instead of saying, how about if we get all of them to do their job? Now, do they need to be trained? Of course. Nerves give the electrical supply and the ability to be trained. And then that's why it goes hand in hand with anything you're doing, whether it's piano lessons, whether it's learning a new language, right? Whether it's whatever. But if breathing, our self-charging unit for electricity, if that is dysfunctional, now breathing takes your energy, where breathing should give you energy. So when your cranial nerves work together, you are a nasal breather, but you're a nasal breather non-consciously. Your cranial nerves are electrical grids. They're connected and they work. But if you can only nasal breathe while you're conscious, that's not the system of the autonomic nervous system, which are your brainstem and your cranial nerves. So it's the foundation for everything. Baseball player, math, doesn't matter. Your eyes have to coordinate. The same time you hear, I breathe, I chew, I breathe, I swallow, I breathe, and I repeat. I can breathe and move my neck. I can do all those things at the same time. It's at the same time. Now, you learn them in a sequence, okay? And I'm not going to teach you something if your nerve is always functional. So that's why I love it. Test, don't guess. Because if one nerve isn't working, it could be like those old-fashioned Christmas tree lights. Takes down the whole grid. So
well, that's what I remember. Sorry to interrupt you. I just want to make sure everybody that's listening, please take a moment to write a question if you have one. We're going to stop at in about 10 minutes or so and answer questions. So please take a moment to do that. I'm going to grab one thing that I learned from you that I think has really changed my head and neck tension. And I've been incorporating your work in my breathing retraining program that is the Starbucks stick. The Starbucks stick that you taught me years ago in that first course that I took. And I explain it to patients that, you know, my clenchers, I got clenchers, Lois. These clenchers are relentless all day and night. And it can be a child, but the adult ones, I will have them start working with oral posture and the Starbucks stick under the tongue with a light suction. And it's really changed many patients' lives if they're open to it. Some of them think it looks silly and don't want to do it. But the way that I explain it is, you know, you have your cranial nervous system and their trigeminal nerve is a little hyperactive. It's one of the nerves that is very hyperactive. A lot of them don't use their nose, so their olfactory nerve isn't working. They can't.
Because
You're right.
It's not in their electrical grid yet. It's not. I guarantee you, if it's in their electrical grid, it'll work. I promise you.
So what I wanted to share is that the breathe in, the pause with the stick under the tongue, and the hum, that you get the hum, activate the vagus nerve, and you do a gentle swallow. I call it an invisible swallow, where you swallow without using any tension, no craning, no extra facial muscles. I know you do a lot of humming in your restorative breathing method. Can you explain what all of that, how it helps the cranial nervous system? What does that do?
Well, don't think about
and the focal point too, and like looking at a focal point. That's
right. So just remember, all cranial nerves have to work for you to breathe. That's why my program is restorative breathing. Do you know how hard it is to restore breathing? We're talking autonomic, automatic, functional, optimal breathing. Well, you have to measure a whole bunch of things to know if you're there. All cranial nerves have to work precisely at the exact millisecond in time with their own electrical equalized grid for everything to be in sequence. We have to have synchronicity, we have to have sequence, we have to have harmony. Then what you have is potentiation. So one flow and one network now potentiates the next one, and now you get massive energy called ATP in your body when everything is building and potentiating. So you're right, you have to have a focal point because we have to look back from just a moment and say, why do cranial nerves get out of sync? They get out of sync because something shocked the system. Okay? Many things can shock the system, and don't use the T word. It's not about trauma. It's about shock. Okay? Label it shock because electrically it's shock. So in shock, the nose swells. Do you know that? So if the lining of your nose swells, can you hear the implications that I can't use it if it's swollen? See, I can't. And the question is, in shock, the nervous system freezes to figure out what? How to survive. So if I need to figure out how to survive, the first thing I don't have to do is breathe. I'm so oxygenated, I don't have to breathe for 60 seconds while my nervous system is figuring out how to keep my heart going. So my heart is going to take over, get the electricity first. I may black out for 7 seconds, of which I won't remember, so I can figure it out. So now getting it back on, what the brain doesn't care about is sound. So your ears get less electricity. Your eyes go kind of wonky. They get out of sequence. So in order to restore natural function, we got to get these wonky eyes that are just a little bit out of sync, 1/100th of a millisecond, get them to focus on a point. The best analogy I have, and I think I figured out a good way to explain. Think of your right brain as an Apple computer, an Apple phone. Think of your left brain as an Android. They're very different, but you can make phone calls, blah, very similar, right? And your cranial nerve system is this magical, beautiful thing that makes them both talk to each other. So the focal point that we do is we get them to focus on something. And you can even say something like, in this moment, I'm 100% safe, because safe is our counterbalance to shock. Looking at, and we describe it, an orange marker. So we just look at it. And here's what happens. My Android sees orange, and my Android sees marker. And in that millisecond, when cranial nerve 4 gets to win, because it's in 4th gear for electricity, it sees, by George, an orange marker. When that happens, we also get electricity through a reflex system to cranial nerve 8. So I can hear. So when my body, well, my nervous system, agrees that I have an orange marker that I'm looking at, I get the potentiation of my right and left brain is on the same thing, and I instantly become more parasympathetic. Oh, isn't that exciting? Because in parasympathetic, tubes get looser or they get bigger. Well, the first tube I need to get bigger is my blood flow tube. Then I care about my airway tube. So in doing that, I'm 100% safe looking at the orange marker. And if I now have a stick between my teeth, my brain feels something between my teeth. In neurology, we have that, and dentistry agrees in this, called a neutral space. Well, in the neutral space, the more the brain feels here, we have enough electricity going there. Now this space here starts to get electricity. When the brain can identify air in the nose, in order to live, that air has to go where? In my lungs. So these cranial nerves have to identify what it is. So air goes in your air tube. And then saliva that can be made is going to go not in your air tube. The saliva is going to go in your food tube. So the most important job of cranial nerve number 5 is to identify air and identify what isn't air. That is what gets disturbed in shock. So when we reactivate it and connect it, oh my goodness, the brain goes, well, based upon the tongue, we have 1.72 ounces of saliva and the pH is blah, 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 blah. Let me add some more saliva to that. Oh, we have to open our throat. Why? Because we have 2 tubes, our air tube and our food tube. When your brain can do this, you will open your throat and swallow, not intentionally, but autonomically. Now, all that electricity goes to your body so that the muscles are happy, so you can work on my balance and posture. But when my airway, because we talk about airway, but it's also our food way, our throat, when it is open, it takes pressure off our spine. It opens laterally. It also pulls those lovely, lovely little things called tonsils back into the walls. Okay, so does it open your airway or does the doors get pulled back into the tonsil so I have more space for more air? But more importantly, my mouth can differentiate what the coordination of the throat needs to be. When that happens, I am massively parasympathetic. I'm self-charging because when we talk about a balanced nervous system, cranial nerve 5 instantly can tell the brain what's going on so you can do 2 things. I can breathe and I can swallow at precisely the same moment in time because the epiglottis can do it. So how do we activate that whole part? We hum. So if you silently breathe in through your nose and hum, I'm activating cranial nerve 5 to go, something, what's up there? Well, by George. So anybody hear of swallowing air? Well, cranial nerve 5 is not telling the brain what's going on properly. So the brain can tell cranial nerve 9 and 10, 11, and 12 how to organize that swallow. When I get electricity there, it'll happen naturally. When that happens, cranial nerve 11 doesn't have any accessory breathing to do. So what's going to happen? The shoulders are going to let go. And when the shoulders let go, I have a new homeostasis. If I keep practicing that 4 or 5 times, the first time I do it, it takes that time for those pathways to become functional. And
when you say 4 to 5 times, you mean that the hum is not as smooth as you would like in the beginning?
But I would practice breathing in, shifting to a hum, wait for my swallow. If I don't swallow, just repeat, because I have to repeat because I will swallow based upon my brain.
So
I've synchronized it, which is my cerebellum. And then the other tube that we care about so much is the eustachian tube, right? So when the eustachian tube relaxes and lets go, because now electricity is going back in cranial nerve 8, when that helps to open up, we have more resonance. We are going to swallow easier. We're going to swallow in this synchronized way. And of course, we add more things to that dynamic. But if I come with my teeth touching, I miss out on so many other functional cranial nerves to join me into the party, so to speak.
There's been so many of my patients that are anxious that they swear by the humming and they swear by the swallowing gently. Like it reorganizes their cranial nervous system in a way that when they feel anxious, they just start to hum, and it reduces, I don't think it clears everything up, but it really helps calm them down. And I tell patients, I'm like, the hum also slows down the breathing. Like a lot of these patients are breathing 30, 35 times a minute. And
Right. And we can give them tons. Seriously, I could talk 2 days of everything humming does. But the bottom line is it turns up the volume of parasympathetic which is everything wonderful.
Yeah.
So I
Yeah.
don't care about calming them down. I care about turning on the system that helps everything grow and organize. Right? It's it. Don't worry about it. And if you don't have that, I tell people put Q-tip between your teeth, put your tongue between your teeth. You can do anything, because if you do that, your brain has more connections up front, and then the electricity is going to go to the back. Oh, I have people that walk around their whole work with a popsicle stick between their teeth. I have people to train themselves with a popsicle stick. And what happens is it gets them open and it gives them functional. Now, is it going to straighten their teeth? Of course not. But they're ready for dentistry. They're ready to be pot. Sometimes the teeth are like shoes. Well, we still need equal electricity to get two high heels level, or to get the tennis shoe and the high heel, and the dentist has to recalibrate, right? We all understand that. You can't work on their gait if they're wearing a high heel on one side, as far as the teeth being out of alignment. But that's how it all works together. So every person can help their own cranial nerves. If you want to do more intricacy, you should learn, in my opinion, how to measure them and how to assess them, because it gives you clear direction. It's neurology. It gives you clear direction. Yes, it does take years to learn it in an efficient manner, but you can learn it. The biggest thing we have to work with is, guess what? It's our own cranial nerves. And that's what I do in a year-long training. We integrate your system so you can see what's going on with your eyes. So your eyes, you can breathe and see. You can breathe here and see. You can breathe, swallow here and see. You can breathe, taste, smell, hear, swallow, breathe, and be in the moment, because that's called what? Presence.
And that brings me to ask you, like, your courses, how can people connect to you and learn this material? I know you were saying there's a year-long course. What other courses and do you want to describe a little bit about any of the courses that you have?
Sure. What we do is, in the past, I teach and I do things for different organizations. So we tailor it to either a profession or something specific. What most people have a desire for is to sleep better. So then I have like a 2-day program. It starts on a Friday afternoon and ends on a Sunday midday, so that we get to build the cranial nerve function for them for their sleep. And so we actually rebuild it for sleep. So they're going to do everything needs to be done to rebuild their own sleep. And then when they go home, they'll go home with what do they need to do to keep going, because it's a coordination. So it's always like we're coordinating your nervous system. Then we're going to have, in the month of June, an intro to neurology program. It'll be on 4 different nights during the week. So just people can get a taste of neurology and practice one thing. So it's an 1.5-hour program every week on a different topic to understand truly the basics, because you've got to start somewhere. And everything matters, but it's not about being perfect. It's about learning one step and getting confident at one step. Just like nothing works if your teeth are touching each other, because that overrides the electricity for all the other systems. Cranial nerve 5 is quite dynamic. So like you did, when you put the straw, when you put this between your teeth, when you put something between your teeth, that's the first stage of getting you functionally connected.
I think the first course I took was 3 days. I think we all had these sticks, and some people had a really hard time. They were clenching and noticing it. But by the end of the 3 days, it's like we were all very relaxed, very, like, our face tension went away, the neck tension went away. And, I tell patients, I'm like, let's just try for an hour while you're at the computer. Just keep it there, because a lot of patients are low tongue postured. They're not supporting their airway. They're clenched throughout the day and night. And it gives them a little tool to really help them be aware, because our minds go into all different places when we're busy at work. And there's some patients that like to be in sympathetic and don't want to leave sympathetic. I don't know if you've ever felt like some people want to stay in a sympathetic nervous system, no? Or do they not have a choice?
Correct. They've had an injury. Most of the time it's a near drowning, and their nervous system is locked in their throat.
Interesting.
They are in fight and fright and freeze all at the same time, because the thing about the brainstem is if it senses you're going to die, it turns off the unnecessary functions, but the person still's living, but they don't hear the same. They don't see the same.
They don't smell the same.
They don't smell the same. They don't taste, and they're struggling for living. But they don't look broken, and they're not broken. That's the biggest impact of shock. Or choking. You could choke and you had the Heimlich. And yes, you have a positive outcome, but that neurological lock is still in your throat.
Thank you so much. I'm going to go ahead. And by the way, that's restorativeBreathing.com is where they could.
RestorativeBreathing.com. Oh, no, it's
okay.
restoringbreathing.com. It's the action.
Wonderful. All right. We have a bunch of questions here. Let's go ahead here. Does hyperacusis as a post-concussion symptom relate to cranial nerve? Hold on, that just bounced right away. Sorry. Is this most helpful for children, or can it be helpful for adults and seniors? And for this type of training for the nervous system.
Your nervous system, this is your fuse box of you. So it's applicable for any person from their first breath to their last breath.
What about those who are mouth breathers because of structural or inflammatory pathology? Is it possible that those patients can't breathe through their nose because of those issues instead of cranial nerve dysfunction?
No, because how your cranial nerves function drives how you also form. So when a palate is totally innervated, the lips are totally innervated, all those things are innervated, you will have a return to function. So every case is different, but you could also have brain damage. That's why, you have to study the whole nervous system, because if the cerebellum is damaged, that is taking away of your coordination of function. So let's just say the cerebellum to the tongue got damaged. So the tongue can't move. So yes, you're going to have dramatic skull function, but you can still return a lot of things to function, even if people are quadriplegic. See, they're alive because of their brainstem. Your brainstem, your cranial nerves keep you alive, but their strength and coordination is your quality of life.
All right, next question is, what is happening in the case of central sleep apnea? Central sleep apnea. What is happening in the case of central sleep apnea?
Well, everybody's central sleep apnea is different, but think of it as a true brain fart. The question is, what? Did the brain not receive the signals from the cranial nerve, or did the cranial nerve not signal? See, those are the things that you look after. If you think of your brainstem to your brain as a cell phone connecting to a speaker, there's a lot of steps for that cell phone to get to that speaker. And so sleep, there's a lot of things, but in order to sleep, I have to be integrating and processing sound. I have to be able to attenuate sound at the same time I'm balancing oxygen, and I have that sensitivity to my sensor. So cranial nerve number 9 is your sensor that has to sense, it has to report to the brain. The brain has to interpret it properly for all of that to work. So you may have several parts of that relay switch that need to be addressed, or one part is going to be a problem. All the steps could be a problem.
Next question says, it sounds like you have some unique methods for assessment and treatment. Would your book be a good resource, or do you run classes? Obviously, you do run classes, but do you recommend the book for learning this or being introduced to this?
The book is to explain to people why cranial nerves are important. It
Okay.
talks about a lot of other things because most people go, why haven't I heard them before? I'm like, well, I don't know. There's a lot of things in the world I haven't heard of before. Do you know? So
Yeah.
it was more an introduction to that you have to have them and your brain has to process them all. But to really look at how do I assess them and then include them? You could start with a neurology program. If you yourself want to have better sleep, you could do the sleep, kind of like a sleep boot camp for 2 days, or you take the year program. We usually start in the fall, and you learn how to do it step by step. And then we work with your system. You get to watch everyone else in the program. It depends what level you want because it is learning a new language.
That program that's a year long, is it in Phoenix? Do they have to go
Yes.
to Phoenix?
Yeah.
So it's once a month in Phoenix, or?
It's about, well, we meet 5 times a year.
Okay.
So I usually give people summers off. Nobody wants to come to Arizona when it's 120. I don't know why.
Yes.
Yeah, so you can do that. So we have summers off for holiday and vacation. And then it's about every 2 months, every 2.5 months kind of thing.
Okay. What is the impact of anesthesia on the cranial nerves and the sensory system?
Oh, good
Auditory
question.
function, it says IE, for example, auditory function.
Well, here's the thing, because I made it my personal mission to visit all the anesthesiology conventions and bring back to their awareness how when you have anesthesia, they alter your CO2 index. So you politely say, hi, Mr. or Ms. Or Ms. Anesthesiologist. Guess what? Well, I want to know, I want to see my record of what number I start with at end-tidal CO2, and I want to be above 35 when I wake up. Is that okay? Okay, when I first started to teach, and I don't remember what year it was, nobody measured CO2 during anesthesiology. So I've worked since I came in the 80s with Dr. Dietrich. He was the director and he started the Heart Institute. He was the first doctor to do open heart surgery. And he knew everything about CO2 because CO2 affects the heart instantly, blah. So he and I would go places and we would just sit there and say, anesthesiologist, we're going to measure CO2. We're going to do this because if you don't, and that person is woken up in a lower CO2 state, say they're at 30, end-tidal CO2, you do not have enough signals for frontal lobe, which is decision-making, attention, focus, and concentration is your frontal lobe. Oh, darn, that part's not available. Auditory is totally elective. You don't need to hear to breathe. You don't need to hear to be alive. So it gets dumped. It's like there's not enough electricity in the panel box, and there's essential functions and there's elective functions. So anesthesia is huge. We can have a return to function. And when they do, healing is fast, post-operative. People come back online, physical therapy, people rehab. And that's how we want it.
Right. Next question. What happens if a client gets pain during that exercise, the stick between the teeth and humming? Pain with that exercise?
Well, it depends pain where.
That I don't know. Assume that there's pain in the face, maybe pain in the face. What would happen there? Okay.
I mean, they could have a broken tooth. They could have an abscess in a tooth. They could have a pinched nerve somewhere. But I mean, the question is, can they chew and eat? You have to have functional jaw to some degree. You could have locked jaw. You could have a slip disc. You could have.
Okay. Next question. What is happening when someone loses the ability to sneeze or yawn?
Well, part of it is your reflex system. So a sneeze is really designed to clear the upper airway, to protect the airway and to protect the lungs, so to speak. So you could have a virus that could affect the brainstem. You could have an injury somewhere in the brain, the reticular activating system. There's many different parts that have been injured, or think of the word maybe altered in some way to yawn. Most of the time with the yawn, I mean, have they had dental anesthesia and a prolonged or an abnormal response to anesthesia? Did they break their jaw? Did they injure their chin when they were young from a yawn? The other thing is you would have to mirror a yawn for them. They could still go through the same resetting some of the airway systems by humming with something between their teeth. And then you would have to mimic the yawn. You would demonstrate a yawn for them. And it's reasonable to expect it 5 to 8 times before their nervous system can sync up with the motor pattern of a yawn. So
Okay.
I know how to reactivate them.
What about this? What does drooling indicate? Oral sensory seeking, question mark? What does drooling indicate?
Well, again, is the cranial nerve feeling the water? Probably not. So the concept of seeking sensory is a label for something instead of let's turn on ability. So most of the time, I don't need to go into why is it this way today? Let's turn on function. So cranial nerve 5 still has to feel what is there. 5 has to talk to the homunculus, the sensory homunculus in the parietal lobe, and it has to then identify what it is, feel it, what it is, and then cranial 5 also works like a scale. What's the volume in there? So if I don't have a good sensory system of all those difference with those pressure fibers, like I mentioned, then my brain doesn't know what's going on. So there's several parts of the brain that have to participate. I could have low electricity to where I don't have enough electricity for my brain to work. And when I get enough electricity, the brain works just fine, right? So it could be an electrical, that's why we use technologies. And we do a lot with technologies. There's many things you can do in developing them to develop and stimulate cranial nerves and develop and stimulate the brain. So to get all those things working is very common in functional neurology. We just have to put the cranial nerves in them.
Right. How often should these exercises be performed? For example, the hum and swallow exercise. What tells you when someone needs to do that, and how often do they need to do that?
Well, it depends what's going on, right? What's going on? You have to look at what is our problem? What's our chief complaint? How long has it been going on? The bottom line is it's a great way to cope until you get it integrated. So I tell people, how often do you use a restroom? If we want our nervous system to work great, the most important thing you can do is answer the call of nature. If you answer the call of nature when you need to and not wait, your brain is paying attention to the signals. So your body signals the brain and we're not overriding it. That's our autonomic nervous system. The call of nature is the end part. So if I'm not paying attention, then I'm not receiving the signals that my body's giving me. So what happens? I've trained to ignore myself. We drink, we're thirsty. Do we use the restroom or the call of nature? And you just say, pardon me for a moment. I'll be right back. I'm going to use the restroom. Right? In dentistry, oh my God, we would be so happy. Haven't gone all day. Well, you're not going to breathe well tonight. It's the same tube, top bottom. People, let's get it coordinated and respect it, because we want it to automatically work. And our brain has to be receiving the sensation. So often to use a restroom. How many people see, the problem is we are so stressed out now, we don't know what stresses us. Maybe do it every hour. Do it while you drive. What's the negative of doing it?
Nothing.
Anybody want a balanced nervous system? For free.
Me.
It's economical, it's quick.
Yeah.
Okay. Why your nervous system can't stay there, that's another issue, right? And that's
Right.
we want to get you strong. We want to get your nervous system strong and coordinated. And most importantly, it makes it efficient. So if you're tired, let's say you have 10 volts of electricity, we want your cranial nerve system to be so efficient in your nervous system that it's only requiring 1 volt of electricity. That's why you have 9 left over for the rest of your life. But if the cranial nerve system is inefficient and it's using 50% of your electricity, do you see how just making your cranial nerve system efficient gives you more energy for your life?
Right. This one question says, why does something between the teeth activate the parasympathetic nervous system? Why does having something in between your teeth activate the parasympathetic nervous system?
Well, when your brain, the big thing too, is one thing is about the teeth, which is going to open your throat. So it instantly activates your parasympathetic nerves. They have to adapt to a different posture, but they don't have to fire for that adaptation. They have to adapt to it. It's not like I'm pushing a doorbell. I'm opening it so that they have, think of it as more space. So they have more space in which to do their job. So let's think about this. Let me find my jaw. So if I put my jaw over here, so if I let my teeth to teeth, so everybody just go ahead and let your teeth go edge to edge in front. Now separate it. Do you see how you're going to move it forward? Well, the most important thing of moving it forward, I'll make this a little bit, is so you have more room for your 2 tubes in your throat. It opens your throat. It doesn't necessarily open your airway. If it opens your throat, you have more room for your 2 tubes, my food tube and my airway tube. Okay?
Yeah.
That is a parasympathetic event because I am opening, but I'm not using my muscle system to do. I'm using my sensory here to be functional. My lips are together. They're touching each other. That is going to create, by me touching my teeth edge to edge, I've activated cranial nerve 5, division 2, which is my nose. So when air flows and I identify, this is going to create a more efficient system. And it's sensory identification. When my brain has very efficient function of my nose, again, I'm using less electricity for my whole body. I'm efficient. I've activated this where my brain now knows where this is in space. I've also decompressed my disc. So you have all these nerves in your disc. So when you open your jaw, I don't have a good lateral of a jaw joint, but when you separate it, then this part isn't quite so stuck up next to your skull. And there's more fluid flow. There's less pressure on the disc. And there's actually nerve base back there. You can even, it actually decreases the tension on the eustachian tube. And it's simultaneously stimulating my right and left brain. Because that's what we have to do. We got to get your brain in the game.
Yeah. Okay, just a few more here. The 2-day sleep course, is that for clients or for practitioners to help their clients?
Anybody. But you're the person there doing the work. You're not learning how, you're experiencing it. Because see, cranial nerves only fire based upon experience. It's your brain stem.
Okay.
You have to touch them, you have to vibrate them, you have to put a little bit of pressure on them. And I mean, the pressure of a Q-tip touching you is fine.
Yeah. Okay. Is the June course Lois just spoke of virtual or in person? The June course.
There's 2 June courses. The online is in the evenings for 4 weeks, 1 day for 4 weeks. So that's virtual. But the sleep program, and that program is Intro to Neurology. The sleep program is in person. I have to visit,
And
touch you.
and that's
One
right.
weekend. Yep. It starts
Okay.
at 5 o'clock
Okay.
on Friday.
Yeah,
So we can
that's
get you
right.
ready to sleep. Then we have Saturday. Then you get to sleep. And then we have Sunday morning, and then you go home.
Okay. Just a few more. That's interesting because aligners cover the occlusal surface of the teeth, and that causes some patients to clench more which is more of a sympathetic response. It
Or,
just says that's
well, but it can be driven by the cerebellum. So the cerebellum can't coordinate it. That's why we want to get the sensory system in first. It's just a sequence. It works great for dentistry because that's where I've done all my cranial nerve stuff for the first 30 years of my life was in dentistry, working with all types of very exciting humans.
What about congenital lazy eye? How does the energy get restored, or what is the dysfunction? Where is the dysfunction? A congenital lazy eye. How does the energy get restored, or where is the dysfunction?
Well, again, you would have to do, because again, that's a label, a lazy eye. What it means in congenital is it's been there since birth. Well, maybe there was birth compression. So in cranial function, you could have compression, retained birth compression in many of the cranial bones so that the eye isn't physically supported. If you look at an eye, this is like one nerve. Pretend like this is the nerve that goes through here. So you could have physical compression on the eye. You could have multiple because you have 3 different nerves that organize that. You could have, depending on what way it goes, it could be different lobes participate in different eye movements. The cerebellum coordinates those eye movements. So the nerve could be fine, but it could be compressed so the signal can't get through. So there's a physical part like the anatomy. You can have the mechanics, how they chew. If it's a little bit tight, then the pressure is in there on that specifically, and it could be coming from the brain. So you still would test them and see what part needs support, because everything to change has to have the proper stimulation, but we have to have optimal oxygen. We have to have balanced CO2 coming out, and we can't have inflammation. But most inflammation, if you work with cranial nerve function, CO2 balances pH. pH helps our what? Our sugar levels. So it all supports each other. It all supports each other. Some people change in 2 days. Some people takes 2 weeks. Some people take 9 weeks, sometimes 9 months. Again, how many steps have to be reconnected? And then when it comes to the muscle has to be strengthened. So all those parts together, that's why it's neurophysiology. Everything has to get connected and work together. I'm working on the brainstem first, and then we can work on other parts. And if somebody else is in charge of the other parts, that's fine. We still want the brainstem to be as efficient as possible. And you'd be surprised when the other cranial nerves work, there's less to do and there's more energy for the eyeballs.
Right. Why do some people suck their tongue during sleep?
Who knows? Probably they had a pacifier when they were little. Seriously, our cranial nerve functions would be so amazing if we didn't have a pacifier. I'm just telling you, a pacifier is the cause of huge cranial nerve dysfunction because my lips never come together. My whole breathing system works around lip apart posture. You are overcoming. An infant can make 50,000 neurological connections a day, and you're going to overcome that at age 7. That's a big thing. So I break it down. If they have lip apart posture, they're age 7, and they sucked a binky until they were 3.5, I go backwards. Okay, so right now I have 8,767 minutes that I have to undo. Yes, we can. Everybody knows people who can do this and help people out. But it's a big, big, big job because all their neuromotor programs are in lip apart function. They're balanced.
You mean the pacifier
The
causes the lips to be
pacifier.
apart?
So you do this, but again, cranial nerve 8 is developed around what? Lip apart posture. Sucking
Okay.
improperly. Every cranial nerve gets connected to a muscle. Sensory to motor programming is unnatural. It's dysfunctional. So if we get cranial nerves functional, it helps everybody's job, in my opinion.
Yeah. This one's interesting. Is decreased hearing upon standing possibly connected to the cranial nerves? Decreased hearing upon standing up.
Well, it's a piece of it, but it's also anti-gravity. So it's your vestibular system, your change in posture. And then, so you have your autonomic nervous system and the vestibular system. If your autonomic nervous system can also be more sympathetic because of the vestibular systems, because when you have, your brain doesn't know where you are in space, there's not enough electricity. Gravity wins every time. Gravity is faster than the autonomic nervous system. So now I've got to use sympathetic in my postural muscles to overcompensate. Okay. So I have to use my eyes to my cerebellum to all the parts, right? I've got to do that. Does hearing count? No, there's no electricity left over for the ears to hear. So sorry.
Yeah.
Because not falling and not dying is the number one thing that the brain has to.
More important at that time.
Well, it gets the electricity first.
Okay. Okay.
So the stronger the vestibular system is with the autonomic nervous system, there's plenty of electricity for everything to work.
Do you see a client in person in order to test the cranial nerves, or can it be done virtually?
It can be done virtually if we have somebody else who is the role of my hands.
Okay. Someone can be you there. Okay. If orthodontic work endeavors to move the maxilla more anteriorly to address an underbite, does this potentially narrow the throat?
Well, every anatomy is different. So I can't comment on that. I take care of very specific things. So I would need all the data to have an opinion. However, while we're into moving things, we still have to have what map does each cranial nerve project to the brain? Because when the maps are accurate, there's a natural rebalancing of all the systems. I know it sounds kind of weird to say that, but it does. Where I am in space, that mandible is following a map, but it could be incorrect. The electricity clearly, the mandible is getting more electricity because it's growing and it's in a class 3 position. If the maxilla is not growing, possibly it's not a full map is accurate, so it's not getting electricity mechanically or from the brain, right? So cranial nerve 2, the second division of 5, could be impinged in electrical circuits, or it has an incorrect map, or what about both? Because what people don't think about, but if you do, cord around the neck is the number one reason for infants not to be able to use their mouths correctly. Okay, we got to resolve that because that limits cranial nerve function. It tethers all the tubes. When the baby stroke,
the cord around the neck, you're saying in the womb
and in birth,
yeah,
because the heart rate drops. Okay, so that's cranial nerve alteration. Just think of cranial nerve alteration. That's what makes things tight. So the mandible is going to work, and it's in association where even, because you can still deliver the baby with the cord around the neck. They say estimate 60% of babies are born with the cord around the neck. So it's very, very, all right. Yeah. But that's why we want to really support the baby in the perfect world before it has to take the first breath of oxygen. Leave the cord intact, your cranial nerves activated, kind of work with the decompression system so things get their fair share of electricity, so the brain can innately connect to what? Suck, swallow, breathe. But I have to feel, smell, rotate my head, okay?
Yeah.
Before I can use my tongue, before I can use my lips. So that's why if cranial nerves are firing, you will have a very successful, if you need to do a tongue tie release. Cranial nerves are not firing, releasing a tongue doesn't change the firing pattern. And a lot of times tongues are limited by the cord around the mouth.
Yeah.
So when that's resolved, you can have a really awesome tongue function, and then you can have awesome maxilla function.
Okay. Just a few, there's 3 more.
Okay.
Sorry to keep everybody. I know this is just, she's amazing. So let's just go through these last 3. Suggestions for chronic hiccups. Someone has chronic hiccups and we want to know how to deal with chronic hiccups.
Well, a hiccup is kind of like a dysynchronization. Okay, things really did get out of sync. And they got to get out of sync between your throat and your nose and your throat and air and food and air, saliva and air. Something got out of sync. Okay, so intervening when they have them, that's not always going to reset them. But prevention is resynchrony. So you have to get them, cranial nerve 5, division 2 has to start working. Smell has to work. You have to be able to smell and breathe when you breathe in. A lot of people can't breathe in and smell. They'll do it, they'll breathe in and then they'll move their face. Well, that's cranial nerve 7. No, we just asked you to breathe in and smell. So again, the more other cranial nerves fire, that's what makes it inefficient. Okay. Do you breathe in and your shoulders move? Well, that's cranial nerve 11. No, no, no. Do not need to accessory breathe. We just want to feel something touch our nose, breathe in and smell. Can you do it? Some people breathe in and smell and their eyes closed. Do you see? So for them to breathe in and smell, other cranial nerves fire kind of randomly. You got to breathe in and smell, because the hiccup is they do that very essential first sequence. Okay. They have to hold something between their teeth and breathe in and smell. Okay. Then you can breathe out and hum, and breathe in and smell, and breathe out and hum. So you're building function.
Yeah. Okay. My son gets cluster headaches. He had a fall and hit his head at 12 years old. He's 39 now. Can this be helped?
Yeah. I would see a functional neurologist. And most of them, and nowadays, are chiropractors. They have amazing training in functional neurology. Okay. You want to do amazing things. They can rebuild systems where people out of nowhere can't walk anymore. It's because it's energy crisis. And yeah, the things that the technology is amazing. It's amazing. We are so close in so many ways that you could almost confidently say, in the United States, when we find certain things, there's a person that has the solution. So it's kind of like you have a master of every little zone. And if you have zone 13, we can find somebody who has zone 13 for you. But many people, many neurological chiropractors can help get you in sync. Now, they're not going to change your teeth positions, but they are going to change the synchronicity of your cerebellum with your frontal lobe, all that.
Yeah.
And now you're not dealing with brain desynchronization. You have, think of it as the engine. The engine's working. Now we got to train the tongue, or now we're going to train the lips, or now we're going to be able to do a beautiful full mouth rehab. I mean, seriously, it is, it happens every day.
Okay. Last question, and I think we've already answered it, but maybe you have a different website for this. Where can we go to sign up for Lois's online course, the Intro to Neuro? Where can they go?
It's restoringbreathing.com. And if you can't find it, just type in my name, Lois Laynee, Laynee, and there it'll pop out. I'm the only one that talks about neurosequencing for the happy life, or whatever they call it.
You're the best, Lois. This has been wonderful. Thank you so much for all of this wisdom. And I know I'm training from you. I've learned a lot, but I definitely need to learn how to integrate these nerves more. So I appreciate all that you've brought and I'm just going to say, I'll give you a call a little bit in just a moment. Do you want to say anything last words to the group?
Practice breathing in and smell, breathe out and hum. Tell your brain, I am 100% safe. Looking at the, orange something. Get your brain in seek gently, but don't make it happen. Just think of it as inviting to the table. Practice looking at something and breathing and smelling. Tell your brain you're safe looking at one thing. That takes the nervous system out of shock. In the last 6 years, there's been a lot of shocking things. Just today, you can take yourself out of shock. Just go slow.
Thank you for that. Okay, I'm going to just share a few slides so you know what's happening next in the next upcoming podcast. This is her book, Winning at the Game of Health. I'm doing a talk at the AAPMD. You might find an email coming up maybe tomorrow on this. It's a free webinar if you'd like to join. It's around children's physical therapy, airway treatments, around posture, breathing, and swallowing. And I'm also going to be speaking at the ADA at the Children's Airway event, July 24th through 26th. So if you're interested in going, here is all of the speakers, and this is where you sign up. So join us in Chicago. And I'm just now launching my own Intro to Airway course as a physical therapist, bringing what I know and what I've learned from all these wonderful experts, bringing this to the field of physical therapy, but also any myofunctional therapist that's on the call, any dentist, any medical doctor that doesn't really understand how to evaluate the airway, how to integrate all of these concepts, and how to stabilize the airway. This is what I'm teaching, and this is where you can find out more. And if you want to be a part of the mailing list and you aren't already, you can use that QR code. Thank you, everybody, for your time and your listening, and I look forward to seeing you on June 3rd at the next podcast. Take care. Bye-bye.
Thank you for listening to the Breathing Lab with Dr. Jenny.